Well, good morning, everybody. And I hope I don't offend anybody, but it is true. My proudest title is mom, and my girls, I have three. They're all in their 20s. And oftentimes, what I like to see on their Facebook posts is when they comment, when my husband posts a picture about me, about their badass mom. So, so it goes both ways. So congratulations to all of you. This is incredible, and I'm just so proud already of what you're doing, what you've done, and what you're getting ready to do. I have to thank all of you for letting me be here, for allowing me to be here. And Dr. Joanne Conroy, thank you very much for reaching out and inviting me to come here. This has been already a very special experience for me. There's such an energy, and there's so much optimism and aspiration that I feel in every one of you. I had a chance to sit in the middle. I deliberately chose the table in the middle of your banquet last night because I wanted to see all around what was going on. And the level of your energy and your interaction was just incredible. And it's very exciting. I think this is so neat that you're getting this master's degree. And I know it's been 18 months, and you probably thought at the beginning of the 18 months how you were going to get through all this and manage everything. And now that it's here, it's kind of probably felt like it's been over now in a blink, right? You've got all these new friends and you've got this network, but what's next? Well, let me give you some ideas about what next might look like and maybe help you figure out. And some of you probably already know what next looks like, but your journeys are very similar to what I experienced. You know, as a healthcare professional, as somebody who came through the system, I went into it because I wanted to help patients. I enjoyed the thought about being able to make something better for another person. And as a result of my training as a clinician and the work I was doing in the military, I had the opportunity to eventually be in charge or be a leader or somebody who managed some of the challenges that we experienced in military health. And it was through that I became even more energized and even more convinced and convicted that healthcare and redesigning healthcare needed to happen. And let me share a story about how that came even more into sharper focus for me. At one point in my career, and you may not know a lot about the ranks in the military, but admiral is one of the highest you can get. And in the Navy, for the other services in the Army and the Air Force, an admiral is equivalent to a general. And then just beneath that is usually a colonel or a captain. So I was a captain in the Navy at the time, and I was put in charge of running a hospital. And we had some challenges in that hospital, but it was an invigorating time, and I figured, because I was starting so far behind, what did I have to lose by rocking the boat a little bit? But it was during that time, as I was finishing my tour at that hospital, that I recognized that one of the events of maturing is that sometimes you start developing chronic conditions. Now, I can take Motrin for the most part for my knees, and maybe decrease the amount of the distance I run. But one of the things that I also recognize is that I was starting to develop a chronic condition that needed a little bit more than Motrin. And so, because I was running the hospital, I thought, well, I know who my primary care manager is going to be, and I made the connection. And we started understanding what I needed to know about what my condition meant, how I needed to manage it, and what I would need to do to anticipate it and mitigate any of the consequences. It wasn't a big deal. It was something that, I knew that other people had developed much more impactful chronic conditions. So through my last year and a half in command, I felt that my provider and I had become very adept, or I was feeling very proud of myself that I was becoming more adept at managing this. As I left command, my husband and I, we were going back to the DC area. In some cases, some people think that's a reward. others not so much. So I was on the fence. My husband and I decided that we were going to bond over our drive back to DC, which is over 12 hours, and we had the cat who did not like being in the car. Don't recommend it unless you've got a really strong relationship to begin with. But about halfway through the journey, I recognized that I was having those symptoms that my provider and I had talked about, and I knew what I needed to do. And because I was also one of the senior officials within the military health system, I knew what I needed to do to make sure that this was a covered benefit, right? You have to know these things. So I pulled into an urgent care center. I had my episode of care, received my antibiotics, received my prescription for my antibiotics, and we went on the way. I get to my duty station in DC, and there's the usual rush of being in a new job and becoming familiar with that. And it was about 6 months into my new job in DC when I thought, you know what? I probably need to go to one of our nearby military hospitals and reestablish a connection, with a new primary care manager. So I thought, okay, well, I know how to do this. So I called the appointing system, and they kept telling me that I needed to call back at another time because all the appointments were full. Is this resonating with anybody? So I thought, and I didn't want to have to pull any strings because at this point, I told you I was a senior healthcare person in the military health, and I thought, the system works. I shouldn't have to call somebody to hook me up, right? Well, after 3 attempts, I thought, okay, uncle, I'm calling somebody to hook me up. And here's the irony, is I used to run this part of the hospital that I was getting my appointment. So I go to see my provider, my new provider, and I'm explaining what happened and my history. And okay, I got to tell you, for the clinicians in there, I gave a perfect SOAP note. I started with my subjective, X number of years, year-old female with this many. I gave a perfect SOAP note. I avoided doing the A in assessment because I didn't want to patronize my new provider, and I didn't want to give the plan because I didn't want to seem presumptuous, right? But here was the deal. While I'm sitting there, my provider is flipping. We still had paper records. We had a combination of paper and electronic. My provider is flipping through my chart and going, well, I don't see any record of your prior appointments. And I don't see any kind of culture results in your record. And I said, well, did you check Alta, which is our electronic health record? And I said, well, yes, I've already gone through that, and I don't see any documentation of what you've been through. And I said, well, I had to go to an urgent care center. I have a copy of the episode of care, but then I realized that I'd left it at home. Not smart. And I heard myself say something to my new provider that I had heard many of our patients say to me in the past. And what I said was, well, I faxed it to the number they gave me. And they told me, well, we don't see it. Now, in that moment, there were a couple of things that I experienced. I could feel the heat rising in my neck and getting to the top of my head. And while I don't blush very often, I could tell I was blushing. I was embarrassed. I was embarrassed because the hospital that I had just come from, my hospital that I had run, somehow didn't have a system in place that accurately captured and recorded my episodes of care that I had received at my own hospital. I was disappointed because all this time that I had been telling our patients that when you go to somebody outside of our system, don't worry, just make sure that your episodes of care, that we get a copy of that so we can make sure that you have a complete record. And I was humiliated because I could tell in my interaction that my provider did not believe me. Now, I considered myself somebody pretty connected in the military health system. And I thought that not only did I have access, but I had influence. But in that moment, I felt none of that. And I thought, if somebody like me is experiencing this, what are the chances that other people that don't have the access and influence that I have experience, what are the chances that they're experiencing the same thing? So in that moment, I decided I am really going to rock this boat, because here's the thing I also realized. I realized I had been part of this problem. I had helped develop this healthcare system that was so difficult to navigate that me, the person who had previously been in charge of the person I was talking to, would have this type of experience. And I thought, as a captain in the Navy, what's the worst that can happen to me if I rock this boat? Well, 3 stars later, I found out what happens when you rock the boat. But I have to tell you, this is an important part of what I think you want to hold on to. You must always keep in mind who the patient is and why we are here. What you've been doing in the last 18 months is not only getting smarter and more knowledgeable and insightful about this very complex system that we call healthcare, but you also need to understand why we are here in the first place. If it weren't for the patients, you wouldn't need your master's at all. I wouldn't need my medical degree. We wouldn't need RNs. We wouldn't need hospital administrators if it weren't for our patients. So I share this story because I recognize that part of our conversations have to include our patient's voice. And it's even better if you have our patients right next to you, sharing what this means to them, what this healthcare system looks like to them. So I would offer to you, one of the first recommendations I'll make for you about what's next after this master's program is find your story that reflects why this is so compelling for you, for what you just did in the last 18 months. Find that story that made you want to go through all you did in order to disrupt and transform healthcare, and share that story. Share that story with others so they know what's driving you. Now, one of the other jobs that I had was running a very, well, it was large. I thought that was large until I got to the Defense Health Agency, but I was running one of the very large markets in the military health system. It had 450,000 covered lives, and it had 13 different hospitals in the area. Now, the thing about these hospitals is they each belong, about 2 to 3 of them belonged to the different services, Army, Air Force, and Navy. Now, you could equate Army, Air Force, and Navy with Cleveland, Mayo, and Kaiser. I'll let you figure out who matches to what, okay? But the behavior and the habits that we had in the military is that Army didn't work with Navy, and Navy didn't work with Air Force, and nobody didn't really work together. The only time we worked together was when we were deployed downrange and there was a war, which is admirable and necessary. And we were doing great things at the pointy tip of the spear, but we refused to learn what we did so well downrange and bring it back home to our own healthcare system. In this large market that I was running, we had a lot of musculoskeletal care that we needed to outsource because we didn't have enough physical therapists, physical therapy assistants. We didn't have enough physical therapy places or equipment to take care of all of our patients. So we outsourced a lot of our physical therapy care. And when we looked at it, I asked our physical therapists, what are some of the ways that we should be able to do this a little bit differently? And they came back, they ran the numbers, and they go, ma'am, now I understand that in the North, for some reason, when people get called ma'am, it's not very flattering. But in the military, you can't start a sentence when you're talking to a senior person unless you start it with sir or ma'am. So I just want to let you know that it is okay. It's not a bad thing. I got used to it. It doesn't mean you're old. It's just a position of respect. They said, ma'am, what you need to do is you need to hire 55 more physical therapists. And I said, and what will that get me? They said, well, we should be able to see our patients on time. We should be able to give them the right kind of care. And I said, have you run the numbers on what that's going to cost us, and where do you think our offsets are going to come from? And I realized as we were having the conversation that I wasn't quite asking the question in the right way. So I asked my staff, could you go back and look at this through a slightly different lens? And I gave them a couple of different lenses that I wanted them to look at. And they came back and they said, well, you know what, ma'am? What we'd recommend this time is that if you would consider contracting for 11 physical therapists, and then we find a way to embed at least a couple of physical therapists in these 4 clinics or in these 4 hospitals, and save the leftovers for our larger inpatient hospitals, then we think we can tackle this problem. And I thought, what an elegant solution. I mean, it was incredible, but here was the catch. 3 of the 4 hospitals or clinics that they wanted me to embed these physical therapists didn't belong to me. They belonged to the other services. So being able to talk to the other services and say, hey, we want to do something a little bit different. We want to embed our physical therapists in your hospital. And we want to see if this will work. Well, it ended up working. And one of the things that we found, we didn't see this right away because most of the data I was using had to do with lagging indicators. And so I had to wait at least 3 months before I started to see the claims come in. But when I saw it in month 4 after starting this, is that we had dropped the cost of our musculoskeletal care by 25% in the first month. And we didn't know that until we got the claims back at the end of this 4-month period. So my second advice and recommendation to you is find ways to partner with the most unexpected partners out there. Part of what you did is you learned about the different industries and their success in financial management and operations. And this is your chance now to work across a very broad spectrum of healthcare and look for those unexpected partners, even the ones, and if you're thinking about something right now like there's no way I'm going to work with X, then that's probably the first person on your list that you need to approach and say, can we do this? And I think that's an important thing because healthcare is complex, but we don't need to make it complicated. And when we stand on our status quo and we make decisions about how we're going to do things on our own, then we tend to make it more complicated. And I'll take you back to my first recommendation. You have to consider what kind of impact that's going to have on our patients. Because if it makes it more complicated, and if it's complicated for the people that are providing the care, think how that translates to somebody who's trying to navigate the care from outside. Now, my third thing that I want to share with you is I told you that I was asking the question in the wrong way about musculoskeletal. And the way I'd asked the question the first time was, what do we need to do to control the costs for our musculoskeletal care? And I realized that what I needed to ask the question was, and I finally got to it, is what do we need to look like in order to make sure that our patients have the best musculoskeletal care and that we have the ability to make it affordable to them and us? What would we need to look like in order to do that? And here's what I want to offer to you that I think is actually one of the most powerful things about approaching redesign and transformation of healthcare. Ask the questions in a slightly different way. Because if you ask the questions in the same way, what you're going to find out is you're going to have a bunch of very helpful people that'll try to get you to know as fast as possible. And it stops the conversation. If you can ask the question in such a way that the conversation keeps going, then you all of a sudden open your aperture to seeing other possibilities. And sometimes your solution sets end up being slightly different than what you started out with. That example I gave you about musculoskeletal care, that was actually the second project we did to address musculoskeletal care. The first one was to find out what it was about our musculoskeletal care system that was not working very well. And again, we had to ask the question in a slightly different way. Our approach to answering it was to do these immersive interviews with our staff, the surgeons, the physicians, the physical therapists, the front desk clerk, But in this situation, what we did is we did immersive interviews with our patients. We actually went into the homes of some of our patients, and we talked to not only the patients, but their caregivers. And what we found out dealing with a lot of wounded warriors, the caregivers and many people who have complex and complicated conditions, their caregivers, their caretakers, are their family members. So when we were trying to figure out what do we need to do to elevate the level of our musculoskeletal care in the National Capital Region for our most complex patients, we spent an enormous amount of time with our patients and their caretakers, their caregivers. And here's what we found. We found that we sometimes use language that is very scary to spouses and children. They may be correct clinical terms, and we may have learned them all in our own special language of healthcare delivery, but they come across as very daunting and intimidating to the people who are closest to the patient. The other thing that we found out is that while we thought we were very clever with using dual tone color coordination in our signage through the hospital, we realized we complicated by putting these words on top of these teal or these jewel purples and everything. They were beautiful colors, but we complicated things by putting words on these signs that didn't make sense to the patient in navigating their system. Now, I share this because we were able to do that really quickly. I didn't need to change a policy. I didn't need to ask Congress to change a law. And I didn't need to post on the federal regulations, the Code of Federal Regulations, a change that I was going to make in something in our health plan. But just by listening to the patients, we found that we could make their lives a lot easier by navigating their care through the hospital in a way that made sense to them. And that freed up bandwidth to attack some of the other things that we knew were very challenging, like the physical therapy and the musculoskeletal care that we did. Now, where do you go from here? I heard some of the comments here. No pressure. We're putting it on you to help us transform this healthcare system of ours. We desperately need people who've been exposed to other disciplines and other ways of thinking. You'll note in my bio that I also have a master's. I deliberately went after a master's to teach myself a different way of thinking and a different taxonomy. Because in medicine, we had gotten too accustomed to justifying why we did certain things based on what we said the patients needed for safety and quality. Yet when you pull the string on that, oftentimes it'd be very difficult to find the patient's voice in those statements. And so I recognized that there had to be a better way of bridging this. So as you consider, what do you do next from here, and where do you take your hard-earned insight and education, I'd offer you this. Find that story, that thing that compelled you to do this in the first place. Make sure it connects with our patients' voices. I mean, they are the reason we are here. Be prepared to partner and find ways to collaborate across our system in ways that I know make you feel uncomfortable. And as a matter of fact, if you are feeling uncomfortable right now, that's exactly where I want you to be. If you're thinking that it'll be easy to collaborate with the hospital down the street, but you know your biggest challenge is a hospital across town, and part of your solution right now is to put a clinic right next to them, I'd offer, ask the question in a different way. Ask what you need to look like in order to take care of the patients in the best way possible and maintain an efficient and effective way of doing it. Class of 2020, congratulations on all your hard work. I know that one of the things that Dr. Conroy told me, that I could speak for as long as I want. She also told me I didn't have to wear a hat. I'm not going to make you suffer through too much longer because I see these really kick-ass hoods here that we're going to put on you. And I know that you want to celebrate with your family and friends here in the back later on. But congratulations to all of you. Help us make a difference. Help us move this dial and make a healthcare system worthy of our patients. Thank you very much.